Chilsla, Jen Procter-Andrews, Sinsanu, Coquille, Halkamich, Mikam, Ichdesan, Kalat na lua tla da Maria, tla Ijao, tla Mitzmitztias. His tla United Nations via the Indigenous Determinants of Health and Jeffrey Roth. Hello, everybody. It's great to be working with you here today. I want to, my name is Jen Procter-Andrews. I'm Vice Chair of the Coquille Tribe. I want to thank Maria for her words of wisdom and for the Indigenous Determinants of Health holding this space for us at the UN this week to share our important wisdom. I'm really happy to be learning here alongside all of you today. I'm going to talk about Indigenous languages as a prime example of how systems are connected. Our languages are often treated as cultural, but for Indigenous peoples, language is a determinant of health. Language carries ecological knowledge, medical knowledge, governance systems, and cultural identity. Through language, we understand how to relate to land, how to use medicines, how to care for one another, and how to transmit knowledge across generations, even from the very first words or thoughts or sounds that a baby hears upon birth. So when language is strong, systems are strong, and when language is lost, multiple systems are disrupted. Let me make that more concrete. When language are weakened or disappear, we lose access to traditional knowledge, including knowledge of medicinal plants, healing practices, food systems, and environmental stewardship. All of these have direct impacts on health, but it also affects identity, because language is how we understand who we are. And when language is lost, we see impacts on mental health, community cohesion, and intergenerational continuity. One of those important parts that makes us human. All of these have direct impacts, and they're not isolated. Language loss is often linked to education systems, governance policies, land displacement, and historical and ongoing assimilation processes. Very specifically in assimilation processes that are ongoing. So what we see is that language is not separate from our lands, biodiversity, and it is integrally connected to health. Language revitalization is also a form of health intervention, because when languages are strengthened, knowledge systems are restored or maintained, identity is reinforced, and communities become more resilient. It's also important that when the languages are reinforced in their communities, they grow alongside our communities, as it should be, as opposed to being appropriated from outside sources and used outside of the community in which they exist, which is a whole nother topic. But it's important that we have the right to use our Indigenous languages in our communities, as our languages have evolved alongside our ancestors for generations. So language shows us again that Indigenous health is not produced in one sector. It is shaped by multiple systems working together. And this is exactly what the Indigenous Determinants of Health framework helps us to understand. Thank you.